Good evening, everybody. Welcome to the Community Scrutiny Committee, Tuesday the 24th of June 2025. I would like to remind everyone present that this meeting will be recorded live and will be capable of repeated viewing or another use by such third parties. Therefore, by entering the council chamber and using the seating area, you are consenting to being filmed and to the possible use of those images and sound recordings for webcasting and or training purposes. My name is Councillor Jodie Lucas. I will be chairman this evening. To my right, I have my vice chairman, Councillor Jeannie Lee. We also have on the top table Fabrizio Ferrari, which is the Community Service Director, Laura Kerman from Democratic Services, webcaster Steve Mitchell, Jen Gould, who is online, and I believe we've also got a head of legal and deputy monitoring officer who may be joining us online if she's not already online. And welcome to those that are also in the chamber this evening. And thank you, members, for also being here this evening. Apologies for absence.
We've received several apologies for absence, Chairman. Councillor Risby, Councillor Markham and Councillor Yarrell.
Thank you. Substitute members?
Councillor Janet Whitehouse is substituting for Councillor Risby, and Councillor Burrows is substituting for Councillor Markham.
Councillor Brooks.
Yeah, sorry, Chairman. Can I give apologies for lateness? I will just explain why, because it's for the it's good news for the district. I've just been to the awards evening at New City College, and every time I go there, I just think how blessed we are to have that serving the young people of Epping Forest. Though there was an award winner who was 70.
Thank you for that feedback, Councillor Murray. I'm pleased that you was able to attend, and you haven't missed anything just yet.
Apologies. I forgot to give an apologies from Wynne Marshall, the cooperative member.
Thank you. Declarations of interest? None? Notes of the previous meeting. So we have the notes of the previous meeting, pages 3 to 16 of our agenda. Do members agree those as a true record of the meeting? Thank you. So next we move on to our work programme, which is on pages 17 and 18 of our agenda. I wanted to just bring to your attention some slight amendments that have been discussed by some members via email. Just to note that some of the policies that was due to be originally held here this evening, which was the PETS policy for council housing and the policy for domestic housing CCTV, they have been drafted, but they are delayed to allow consultation with the tenants and leaseholders panel. So I've accepted that from the officers that this was a valid reason, and those items have been moved to the work programme for the 16th of September. I believe that's the only changes to the work programme as what has been previously shown. Does anybody have any questions or comments? Councillor Whitehouse.
There seems to be quite a lot of policies already there for doing on the 16th. So what, the extra ones are going to be quite a lot, aren't they?
Thank you, Councillor Whitehouse, for raising that. I did actually raise this in my chairman's briefing. I wondered if any other members was going to make any comments on that this evening. I have asked if there is the potential that we could add in an extra meeting, if anybody would rather that than sort of look at many policies on the same evening, or if you're in a policy mood and you just want to go through the policies on the same evening. I'm in your hands. I did raise it personally myself, but I just wanted to know this evening if anybody else felt the same way.
I feel that the PETS policy...
Councillor Whitehouse.
Apologies. I feel, the PETS policy is important that we thresh out. And, we have had in the last year some very long meetings, sometimes with quite important things stuck at the end. And perhaps we do need to think about having another meeting.
Councillor Dadd.
On the matter of PETS policy, I have had a meeting today with Keith Bowman, and there are going to be some amendments to it, and I think he would welcome any changes to the draft one before it comes to committee.
Councillor Murray.
Yes, I would endorse the view that if scrutiny of these important policies are going to mean anything, I think we should have an extra meeting. I have to say, I thought that, and I'm not going to make a big issue of it because it has been accepted in the exchange of emails. But given the interest by some of us because of the wards we represent about the pet policy, I think it could have been better communicated that it wasn't coming to this meeting, because I certainly had a fair number of tenants because of what I had been told that was expecting it to come to this meeting, and it wasn't communicated particularly early when that decision was made. In fact, I wasn't aware when I didn't see it on the agenda. Okay, I could have looked at the draft programme and I would have picked it up, but I was looking at it, I was looking for it as an item, and I had been led, not by Democratic Services, I hasten to add, but I had been led to believe for several months from Housing Services that it was coming to this meeting, and I had told quite a few of my constituents. But that's fine, it's been accepted that it wasn't communicated very well. So the important point is I do share the point about I think it's too many policies for one meeting.
Okay, so I think it's fair to say that members share the same view as myself.
Just the suggestion, perhaps you would like us to include the version
It's updated.
after discussion with officers and
Takes ages these days to get into Montgomery.
No, I never used the Gov anymore. I use the website.
Okay, so the update from Laura just then was that it may be sent an idea to put the draft policy as it is into the minutes of this meeting so that they're put on record. And then, please do, Laura.
one way forward with this may be to for the officers to consider the alignment of policies to work out which ones should come through as priorities. We'll look to develop another meeting, but actually to put the revised schedule in the minutes of this meeting so it'll be available early, and then to add that into the members' bulletin so that all members are aware. Obviously with work programmes, technically they go to Overview Scrutiny for approval, but that may be a potential approach if obviously the chairman and members are happy with that.
Sorry, I misunderstood what Laura was saying initially. Are members happy with that idea? Okay, so that will be our way forward to try and address that situation and to make us not have so many policies on the same evening. Okay, so is there any other comments on the work programme? Is there anything else anybody particularly wanted to see included? Not for now. Okay, thank you very much. So we will move on to our main item this evening, which is the progress on Epping Forest Health and Wellbeing Strategy, which covers 2022 to 2026. And Fabrizio is here to introduce the report and has a presentation for us.
Let me just share my screen. Everybody see that? Okay, perfect. Thank you, Chair. Thank you, councillors, for this opportunity. I'm Fabrizio Ferrari. I'm the I'm the Acting Director for Communities. I was about to get my title wrong there. And I'm joined by my colleagues Laura Cleverley and Wendy Cockbill, who are here to join me in the presentation and talk through the presentation as well. So in today's presentation, we will cover an overview of the strategy and its governance to give it a bit of background of when the strategy was developed and how. We'll talk about the key successes of the strategy this year. We'll look at data and trends, which is what we use to monitor the strategy's progress, and then we'll look at next steps and what we're going to be doing to combat some of the issues that have been raised in the data. So the Health and Wellbeing Strategy was launched in 2022 after extensive consultation with both stakeholders, partners and the public. In fact, about 55 different partners engaged in the consultation of this strategy because it is a partnership strategy. The aim of this strategy is to look at the whole system and what we do to improve health as a whole system across health and wellbeing and wider economic development and other areas. What emerged within the strategy was 5 key priorities. The first one being improved mental health and wellbeing. The second, reducing loneliness and social isolation. The third, increasing physical activity, but also looking at improving healthy weight of residents. Supporting residents in relation to the rising cost of living. And tackling alcohol and substance misuse, all with the overarching strategy or aim of the strategy to reduce health inequalities, which is one of the key priorities of the strategy and of all the partners. To deliver the strategy, we have some key founding principles. The overarching principle of the strategy is that health is more than just the food we eat or how active we are or the care we receive from medical services or services within the community. Health is about all of the elements that make up our life, and I think it's perfectly represented, and we use this model a lot within health, within the Robert Wood Johnson model, as you'll see here. Ultimately, it shows us that health is made up of all the factors that make up our everyday life. The different percentages and so forth can be argued, until the cows come home, but ultimately, I think the overriding principles of this is that actually what our health is all of the different factors that make up our everyday life, and all of these factors are influenced by the systems that we as a local authority and wider partners work within. In recognition of that, the strategy has identified this as the key founding principle of its work. Other principles that we look to work to are prevention and early intervention, because prevention and ill health is key. It will help us ensure that residents live better lives and more fulfilled lives. It will free up services and help access to services. It also helps within early intervention. So if services are more accessible and free because we've done our job in terms of prevention, then actually when you do get ill, your services are more accessible. The other thing around early intervention that we try and achieve through the strategy is for the right services to be in the right place at the right time. Our aim is to bring services into communities in the areas that need them most. Another founding principle is around self-care and management of own well-being. This is about empowering residents to manage their own well-being and ensure they have the knowledge that they need to live a healthy lifestyle and fulfill their needs and their wants within life. It's also about ensuring that if residents do get ill, that then they have the specialist services there to support them and manage that illness and help them lead a fulfilled life. We also have the place-based approach. This is a key principle in recognition that some of our areas in our district need more resources and they require more resources and access to services. This could be due to rurality, it could be due to deprivation, or it could just be because of the needs of those particular communities. Ooh, we seem to have lost the screen. Shall I continue, Steve? Or? Yeah? I've still got it on my screen, so everyone's still there. And then finally, the life course approach. And this principle is all around the fact that actually different services need to be delivered in different ways depending on people's life and where they are in their lives. So obviously early years services will be different to what we deliver to older residents. With older residents, there is probably a need to make things less digital and support them more to access services, whereas younger in life, there's more access to services through digital means, and people may choose to access services in different ways. So the governance of the strategy is ultimately delivered in a way that reflects the whole systems approach. The board is responsible ultimately for delivery of the strategy, and then the action groups are there to deliver on the priorities and deliver projects and interventions that will impact upon what we want to deliver through our strategy. Annually, we develop an action plan that identifies the needs and projects we want to deliver, and then that action plan is taken to the board for approval, and then each quarter we scrutinise the action plan and identify if it's achieving what we want it to. The structure of the strategy is the structure and governance, as you'll see via the various action group, reflects the fact that health is more than just health itself and clinical care, but actually looks at all of the different elements of health. So healthy behaviours, socio-economic, community safety, the clinical element, and then the built environment, as was highlighted in the Robert Wood Johnson model earlier. I'll now pass over to Wendy to talk through the priorities for 2024-25.
Thank you, Fabrizio, and thank you for having me here tonight. So our priorities, each year the board and action groups look at the data to set their priorities for the work for the following year, as Fabrizio has already mentioned. And the projects are developed collaboratively by the action group partners, and as Fab again has said, that we monitor them quarterly. And you can see up there, I'm not going to read through them all, but you can see up there some of the priorities that we actually looked at during 24-25. And I can talk you through some of the key successes. So, first of all, we were really proud to be able to receive £237,000 of Public Health Accelerator funding from Essex County Council. And for that, we were able to employ 2 dedicated community engagement officers to 2 of our areas of higher deprivation, and that was Limes Farm and also Oakwood Hill. But as well as that, we also have our own community engagement officer that we were able to continue the work that we had already started in 9 fields. Those projects have been really successful so far, and I know we've got councillors here tonight that actually work quite closely with some of our officers too. We have developed 23 new projects in these areas in the last year to work in line with the priorities set by the action groups, with over 4,000 attendances of residents in those areas. And also we've got to remember that those 2 community engagement officers that we recruited only actually were employed from the summer of last year. They haven't even had a full year yet. We were lucky enough as well to receive £10,000 of Active Essex network funding to support the place-based approach, whole systems approach work that we do in those areas. Some of the activities, that's to improve the physical activity of the residents. Some of the work that we've been doing there, the Ladies Dance and Dine, that actually had 60 people engaged in that. And that was a really good programme because anybody could go to it and they did a different dance every week, and then they made food afterwards and were able to have lots of discussions for their mental well-being. We also put on some basketball at the youth club. There was a fantastic falls prevention programme, inclusive football, Zen fitness, yoga, meditation, boxing, to name just a few. There is one project as well that we're looking to support, and that's at Oakwood Hill, and that's with the table tennis project that they have going there. We also have been able to expand on the 2 community pantries. We have one in Buckhurst Hill and one in Chigwell. We work very closely with Essex County Council, and they have been really supportive, and they've given them lots of funding too. Just a few figures. So for Buckhurst Hill, they currently have 266 members that visit their pantry, with 135 shoppers in April alone, and each of their members are saving an average of £28.58 per visit. They receive their funding from Essex County Council, Feeding Britain, their local churches and schools, KFC and Booker's Wholesale. Chigwell Community Pantry, that one, if I can give you some figures there, in September 24, they had 24 customers. With all of the work, all the place-based work and all the community work that's been going on there, and also liaison with the schools, etc., and those partnerships being built up, that figure from 24 shot up to 92 customers in March 25, and they now have a total of 141 members. They again have received lots of funding from Essex County Council. Chigwell Parish Council loaned them the venue to use. They also attracted Winter Activate funding from Essex County Council, from Active Essex, to be able to put on a lovely Christmas party for the families. And that was so well attended, and they had Christmas presents and they had a party, they had Santa. It was wonderful just to see their faces. Another good thing from that pantry is that some of the members who were really struggling financially and were shopping at the pantry, they actually now volunteer there. And also customers are coming from as far as from North Weald. So what we really want to do is eventually try to develop that model elsewhere in the district. With the hub at Chigwell, they have other offers there, such as My Weight Matters to help with the obesity problem, tea rooms, bereavement and memory cafe, and they've recently started a men's wellbeing group, and I believe that's really well attended. And also we do have Epping Forest Affordable Counselling there. So we're building up a really great hub there, as well as the hub at Oakwood Hill. Let's not forget to mention that one. That's really predominantly run by Restore Community Church, and there's been lots of partners there, and I believe that is gaining momentum as well. With economic development coming into the Communities Directorate, we've been able to invest UK Shared Prosperity funding, and part of that was the digital inclusion programme that has been delivered in the past year by Voluntary Action Epping Forest, who reported that 764 residents took part in workshops. That contract has now been re-awarded to Voluntary Action Epping Forest, and that will carry on delivering across the district. Another thing was from the UK Shared Prosperity funding, we were able to offer the Level 3 award in preparing to work in home-based childcare across the district, and we really did try to prioritise our areas that we're concentrating on, and I'm pleased to report that 81% of those that enrolled onto the course came from those 3 areas. At the end of that programme, 13 of those were ready to start business and can now offer up to 6 childcare places each. They did actually get wraparound support to actually starting their business as well as the actual course that they took. Female Entrepreneur Programme, that's been another real success with 94 residents taking part on that. At the end of that programme, there were 63 businesses that were ready. 5 are since trading, and the others are also able to set up soon. Places Leisure, we have good partnership with them to improve the physical activity in the district, and they've done a lot of programmes for those that are living with long-term medical conditions or disabilities, such as a Parkinson's Move and Shout programme, Move Through Menopause, Falls Prevention programme, free swimming for families that have children with free school meals. And one thing I also really love is the Big Sister project, and that's helping girls when they're going through puberty, and that one has been really successful. Also, there is the vape report that the Youth Council have really been working on, and I know that they surveyed 2,924 secondary school students within the district. The report has been published very, very recently, and there are some astonishing figures in there, and I know that the Youth Council are looking forward to their youth conference in November. Thank you very much.
Thank you, Wendy. So, moving on. So what progress have we done against the strategy and against our dashboard and the data? So every year we develop a dashboard, or we utilise this dashboard to identify what the data is telling us. The dashboard was approved by the board back in 2022, and it brings together different data from different open source data sets that we can utilise under each priority to identify if we're achieving our aims and objectives against the strategy. What the dashboard will show you in a moment is the trend over time against the baseline of the strategy, against the baseline data back in 2022, and then what's also highlighted is where we've been able to update the data this year. At times, unfortunately, with data, particularly that comes from the medical system, it's not always updated regularly, so we have picked indicators that we try and update as regularly as possible and get that data as regularly as possible. So what's the data telling us? I suppose the key one here on this first around improving mental health and well-being is actually there's a couple of areas where the data is showing us that actually increased trends in severe mental health issues, and also an increased trend in suicide within our district, which is a key priority, as you'll see going forwards, particularly because pre-COVID and pre-pandemic, our district had very low suicide rates, but actually they've climbed quite high within the last few years. And it's particularly between the age bracket of the 40 and 60 and predominantly males. So there is an issue there that we will investigate going forwards. Around loneliness and social isolation, I think the overriding trend here is that actually crime is down and reported crime is down, which is great, but people's perception of crime is actually increasing and people's perception of not feeling safe in their communities is increasing. I think that can quite easily be read from the data there. In terms of supporting residents through the rising cost of living, this is probably the indicator that's performing the best, or where the strategy is probably performing the best. Employment's up within our district and trending upwards. Unemployment is quite stable. It's only gone up by 0.3%. People living in poverty, older people living in poverty has stayed stable. Children living in low-income families, it seems to be decreasing, as does the modelled estimates for household fuel poverty. Physical activity, this one's a bit difficult to read. Physical activity amongst adults is increasing, which is very good, and physical inactivity is decreasing. However, obesity amongst adults is going up. So that clearly shows us that actually there's some underlying issues around nutrition, particularly if you look at the fact that adults who are eating the recommended 5 a day of fruit and veg is decreasing. So there's clearly something wider there that we need to tackle around obesity and issues within our society that are causing obesity. Physical activity amongst children is also decreasing, which is an issue and something that we will look at going forwards. However, obesity and overweight children seems to remain level, and actually for year 6 is children who are getting older is actually decreasing. And then finally, tackling alcohol and substance misuse. So alcohol admissions to hospitals seems to be decreasing across the board, which is very good. However, state-based crime, so that's the trafficking and possession of drugs, seems to be increasing quite significantly. I think this ultimately shows us that actually there's probably an underlying issue around the use and possession of drugs within our district that we need to look at in partnership with our colleagues in the Community Safety Board and probably identify as a priority to take forwards. So what are our next steps from following the data and analysis of what we've seen? So the key one is to sustain what we're currently doing and try and maintain many of the projects that we're doing and ensure that they're funded well into the future. But what we also want to do is create, around suicide prevention, is for the board to conduct a deep analysis into the causes. We've invited colleagues from Essex County Council to come to the next board in July to identify what the data is telling us, the trends, and see where we can add value to what currently is being commissioned by Essex County Council. And also then develop our own projects as well, which will be bespoke to our own needs within the district. We'll also be looking to develop a multi-agency suicide prevention group across West Essex, so we can look at joint funding across the whole of West and also look at bringing in more resources and more funding, because if we can do it at a wider footprint, we'll get more funding ideally. And finally, as I've already mentioned, we want to do something bespoke for our district. So to do that, we need to look at the data and the data to enable us to see where the key priorities for us are. Priorities around loneliness and social isolation, that still remains an issue. What we've done this year so far is we've recommissioned the digital programme, the digital inclusion programme, using UK Shared Prosperity funding. We're currently working with our colleagues at Citizen Advice to expand the multi-agency service hub that they currently have in Waltham Abbey into rural areas. This morning we met and identified 6 key areas that we want to look at and explore. We want to grow the community pantries alongside those hubs and bring the community pantries into rural areas to help residents who may be struggling and may not be able to get to supermarkets due to transport or due to financial issues. We want to support the employment of neurodiverse adults, so we've commissioned a programme with our colleagues at County Council where businesses can apply for a grant to help them employ neurodiverse adults. And finally, we're setting up and developing town and village partnerships with key areas to look at not only growing businesses, but also look at growing employment and growing activities within those towns and villages to try and bring the communities together. In terms of excess weight, Essex County Council recently released their healthy weight strategy for Essex. We are inviting them to our next board to look at developing a joint action plan, particularly around key areas such as policy and planning, fast food advertising and other areas, because that is a county. A county will lead on that and county have the responsibility around those areas, but also then look at where we can access funding from County Council around this strategy to look at our own bespoke projects locally. And we have commissioned a few initiatives locally to start with. One is free membership for families and children who are on the excess weight programme, and they'll get free gym membership or swimming membership to Within Places Leisure. So we've got a few programmes we've already started with, but we want to look at developing more. And then finally, within that as well, we want to put a greater investment into physical activity for children and young adults, particularly as you saw within the data that the physical activity levels are decreasing, so we want to try and reverse that trend. So we're going to work with colleagues at Active Essex to try and develop more funding in those areas. And then finally, around drug misuse, this is something we'll look to work with our community safety partnership on and identify any areas that we need to do more work together, particularly around diversionary activities, looking at county lines and see how we can bring young people away from those bad influences and into positive influences within their estates and within their housing areas. And that's everything from us. So any questions, please? Thank you.
Thank you very much, Fabrizio and Wendy. That was a very great presentation to hear from you. Do we have members' questions? Councillor Whitehouse.
Right. Yes, so there's 4 things I wanted to comment on. But first of all, congratulations on the programme. There's obviously some great achievements there, and lovely to hear about them. Are we going to get these slides afterwards? It'd be really nice if some of the figures that you were mentioning could be put in there, because it makes more sense then of the achievements that you put up there. The achievement I particularly wanted to praise was the Female Entrepreneurs Project. Last Saturday, I met someone at the library's sort of family day, and they were full of praise for the programme. They were, presenting their new business, and it was great. I hope it goes on to be very successful. My question is about the Falls Response car. It started in June 2023, I think it says. Just wondering how exactly it works, because someone I know was on the floor for 6 hours within the last 6 months, and it was the ambulance that came to her. So what is the sort of link between the Falls Response car and the other sort of services that come? Perhaps you could answer that, and I'll go on to the other 2 things.
Thank you very much for the question, and I think I'll probably take this one with my clinical hat on, but we are very, very lucky in West Essex that we have the West Essex Falls Response car. It's basically a dedicated ambulance which is kitted out. It's a service which is commissioned by Hertfordshire and West Essex ICB via EPAs, so it's not necessarily us at the local authority level that are funding it, but it is something that we signpost our residents to. But essentially, the way for a member of the public or a patient to have the Falls car dispatched to them is that there is a dedicated phone number for the Care Coordination Centre. So the idea is, from the point of referral, it can be done via a healthcare professional, it can be done by a member of the public as well. So the Falls car, once it's referred into, will dispatch this dedicated non-blue light ambulance, so it's not sort of coming with blue lights on. It's for non-emergency purposes, but it's kitted with a paramedic, a occupational therapist, and a physiotherapist as well. So the idea is they go out to the person who has fallen, they perform an initial assessment, and then they make a clinical decision as to whether somebody needs to be conveyed to hospital, and then they would arrange an emergency ambulance to facilitate that. Or if it's sort of a superficial or a minor injury sustained as a result of the fall, they would safely aim to mobilise the resident, look at sort of any of the risk factors which have resulted in the fall. Has there been sort of pieces of carpet sticking out, or is there sort of broken equipment or unsafe equipment? And then sort of look at ways of kind of linking in with some of the other system partners, be it social care, be it primary care, on ways of sort of more kind of specific falls prevention, strength building, rehabilitation, all of that kind of stuff. So it's a very, very unique service. We are very, very fortunate to have it in West Essex. It is not something which is available across Mid and South or North East Essex, something that we are heavily acknowledged and praised about. But I hope that gives a little bit of an overview of what specifically the Falls Response car does.
Yeah, I understand what happens when the car comes. What I don't understand is how you get the car rather than the ambulance. I mean, the friend made a 999 call and the ambulance came after 6 hours rather than the car coming within 2.
So it would likely have been a 999 ambulance which would have been called out for. So if somebody presses 999, it goes to the East of England ambulance service. It doesn't actually go directly to this community-specific falls prevention car or falls response car. The easiest way for a member of the public to access it would be via their GP surgery or the number for the Care Coordination Centre, but it isn't something which is easy to remember. It's a 0300 123 something number. So for a member of the public, if they have a fall, and it's usually within the home setting, it isn't in a shop or a shopping centre or the high street setting. If it's at home then and it's in hours, then it would normally be accessible via the doctor's surgery. So a 999 ambulance is not going to result in the falls car being dispatched, if that makes sense. So the 999 ambulances go to a dedicated East of England call centre. It doesn't go to the specific West Essex falls response car.
Okay, I won't pursue it now, but it still seems to be a rather roundabout way of trying to get the car, not what a member of the public would sort of immediately think about, but let's hope it can be made available to more people. Then moving on to social isolation, what causes most social isolation is transport. I mean, we have a lot of wonderful clubs in the area, 5 U3As, at least 2 women's institutes, groups for singing, for art, for sport, so many things. But when people go up driving, they find it very difficult to get these places. Taxi fares are so expensive. So, I would hope that some of the money could be used to provide transport. I mean, obviously you can't do it for just one person, but if you've got an area of people that are socially isolated that you identify, could you not find out what their interests are, tell them what the local clubs are that they could go to, get it down to 2 or 3 that they'd like to go to, got a taxi full of people or a minibus full of people, and just help to get them there, rather than spend the money on sort of specialist things just for them. There's so much that the clubs would be pleased to have them, and the people would be pleased to continue their activities. So it's just a request to think about that when you're thinking about social isolation. And then finally, the thing I wanted to raise was suicide. That is a shocking figure, and it's terrible to think it's going up. But I think members are completely ignored in this. You're going to have training for all these partners. There's nothing about training for members. One of the tenants in my ward that I've been working with for over a year suddenly decided that suicide was the only way out of her problems. Fortunately, she rang 111 and the crisis team came and the crisis has passed. A neighbour in another area told me of someone who's just moved from the area who also wanted to commit suicide, and the neighbour just got there in time. We hear of these things, we work with the residents. I think we could do with suicide prevention training as well. So if you could just bear that in mind. We do know our residents in a way that, other people perhaps don't. Thank you.
Thank you for that valuable input, Councillor Whitehouse. I think Fabrizio has been making lots of notes and nodding his head, so I think they will definitely be taken on board. I don't know if you want to come back, Fabrizio.
Yeah, in terms of suicide prevention, that point well made, Councillor. I'm happy to look into that. We have rolled out training, and there is training from Essex County Council that we've rolled out to frontline staff, and I don't see why it can't be extended out to councillors as well. It is a free training programme. We have a log into it, so I will put that forward to council colleagues. I'll also, one of the other things we look to do and we have pushed for is suicide prevention training within the community itself as well. So for anyone who wants to and wishes to, we could put that training on. That's something I'm going to apply, try and look for funding for. We have done it in the past. We did it pre-COVID, and I don't see any reason why we can't do it again. And I think that is, the more we can expand the knowledge and support, then I think the better we'll be at preventing the issue and dealing with crisis as well. Thank you.
Councillor Nwuki, please.
Yeah. So I was just going to say, sorry, in terms of the number for the Care Coordination Centre, I'll put that on the notes and the minutes as well and on the presentation. So,
Councillor Nwuki.
Thank you, Chair. I think I would like to make a brief comment before asking 2 or 3 questions, if you don't mind. Yes, I was just reading the report, and what stood out to me is the increasing suicide rate and the loneliness. And as someone working to establish men's shed in Loughton, I was really concerned about this. But the report also reinforced why our initiative to establish men's shed is urgently needed. Men's shed is internationally recognized as effective intervention for male mental health, loneliness, and social isolation. They provide structured social environments where men can connect through practical activities, share skills, and build supportive environment. And I'm pleased to say that we have support already, significant support in the community, support from the Loughton Town Council by providing 2 buildings for men's shed. And we have support as well from Epping Forest Council, which I'm so pleased about. There's a lot of support coming from the council, from officers. But however, we need more for these. The buildings require a lot of work, and to make this suitable for men's shed. And tonight's report identifying reducing loneliness as a social isolation and as a key priority for 2024-2025. Well, the success in the ladies dance and dine program show that we understand where the issue is. But as well, Menshed will provide similar activities for men, because the highest suicide rate is within men, and most men suffer mostly from isolation. So the report also mentioned challenges on partner engagement, where we as trying to start Menshed, we're offering that opportunity to engage with the council and to work with people, everyone, to try to prevent the loneliness among men. So, as the report shows, your activities and bespoke intervention for the districts, Men's Shed isn't just an idea. It is a proven model that directs critical environment where men can engage. And I think that's something that we will urgently need in the district. So, saying that, I have 2 questions that I would like to ask in it. The first one is, the report had identified reducing loneliness and social isolation as a key priority. How does the board plan to specifically address this, especially for male isolation, given that men often struggle with access to traditional support services more than women are more able to identify with such services, but men struggle to attend such services. And secondly, given the increasing concern in suicide rates highlighted in the report, what specific funding streams could support community-based initiatives like Menshed? Thank you.
Thank you, Councillor. So in terms of how the board will look to address the issues around male suicide and social isolation in general, so as highlighted, we've got the hubs that we want to take out into rural areas. We would look to, within our place-based approach, look to work with councillors such as yourself and other volunteers who want to put on activities. We've got at the moment a very good walking football session. We'd look to expand that. But I think really the key is going to be looking at the data and what the data tells us, and then identifying what we need to do from there. And look at where the areas are, because there is a concentration, from what I was told by county council colleagues, around where these suicides are occurring. So it's around, but we need to be led by the data to start with, and then we'll identify the trends and ultimately the activities that can support that. In terms of funding, it's a difficult one. So direct suicide prevention funding, there was a pool pre-COVID and there's been a few rounds. However, there isn't anything I'm aware of at the moment. That's why we are asking our county council colleagues to come to the next Health and Wellbeing Board to look at what is available and what we can do locally. And that's also why we want to set up the West Essex Suicide Prevention Forum to look at a bigger picture and see how we can get more national funding, because there's a bigger footprint. We can bring more national funding rather than smaller pots of funding.
Yeah.
Councillor Pugsley, I think you're not on mute. Thank you. Sorry.
That's right. Pleasure.
Sorry, Fabrizio.
So that's kind of our aim and our objective at the moment. But really, I think we need to be data-led and we need to identify what the data is telling us. But I commend the Men's Shed. It is a brilliant project, and our officers will help you as much as they can to get that going. And if there is any funding we can source for you, we will let you know, and grow with the volunteers that can support in that project as well.
Do you want to come in, Councillor?
Thank you very much, Chairman. And if I could just add on to Fabrizio's points, I think it's something actually that we looked at when we were analysing the data, that absolutely the suicide rate having gone up was something which was very eye-opening. I think obviously the data sets are one part of it, but actually also getting to the root cause of the problem, understanding some of the reasons why people feel as if that's their last way out, and until and unless it can be addressed at a wider system level, as a local authority, we're just one piece of the puzzle. So that was just something that I was thinking about as you were asking a question. But generally speaking, when we look at the slide on the mental health and well-being of residents, actually I think, whilst the suicide rate has gone up, some of the other indicators we've actually improved upon. So if we look at, for example, the depression cough incidence, that is something that has come down. So the number of people with a new diagnosis above 18 with depression has come down from 2.2% to 1.7%. And if we look at when this data was compared against, I think from 2017 compared to 23-24, actually the world is a significantly different place, you know, from the cost of living crisis to, you know, geopolitical situations, so many different factors which can affect people's overall mental health and mental well-being. So if we look at sort of some of the gains that we've made, that along with overall how satisfied people are with their life nowadays, you know, we've managed to improve that as part of the Essex Resident Survey from 17% up to 19%. So, you know, whilst we acknowledge that, you know, there are room for improvement, I think we should also recognise that there's been some really good progress that's been made just 2 years into this strategy, and, you know, hopeful to take everybody's comments on board to see how we can improve it further.
Noriki, did you want to come back?
Yes, thank you, Chair. Just reading the report as well on the paragraph 3, progress reporting. It says here, dashboard was developed following extensive analysis for open source data. I was just wondering, what does that mean, open source data?
Thank you, Councillor. So, yes, open source data is data that's publicly available. So we use websites such as Fingertips, which is by the Office of National Statistics. We use Essex Data Portal, which actually is a very good data portal. It brings everything that is really ultimately openly available to everyone into one concise document. I think where we do struggle really is some of the more clinical data. We struggle to access that. That's obviously not as renewed and refreshed as often, as is some of the more quantitative data, such as the Essex Resident Survey that was done in 22 and then renewed in 23, but then never renewed in 24. So there is a lot of data out there, but a lot of it is not often renewed. It goes in cycles of maybe 3 to 4 to 5 years. So we try and do what we can with the data we've got. I think one of the pieces of work that I'm going to take forward with colleagues as well is working with County Council, because they have big data teams, and getting them to actually check the dashboard and check the data is correct. And if there are any other measures that we could utilise and insert, then we'll utilise them as well.
Councillor Dadd, please.
Thank you, Chairman. And first of all, I want to actually say what a great piece of work you've been doing in the last couple of years. As a relatively new councillor, I haven't been aware of this. I know it's all add-on, if you like, and also pleased to hear that you've been working with the Community Safety Partnership. One or two, would have had lots of questions, but it's really because I want to know more. But one thing that did strike me was the strong sense of community has decreased. And I think that some of that is really, really key to some of the other issues like social exclusion and suicide and all the other aspects. And I know all the good work you've been doing has been in the urban areas, and I'm wondering how you're going to be able to take it out into the more rural areas. I represent Ongar, and, you know, there are obviously similar problems there, plus the transport problems. And you talk about town and village partnerships. And I'm wondering whether you have actually got in line working with town and parish councils. I can see you're nodding there. And the other thing is, I'm hoping that you have got the funding to go forward with this and expand it. And how are you also going to reach some people? Because I hadn't heard of some of this, and it may well be some of the not well supported things haven't reached the right people.
Thank you, Councillor Dadd. So in terms of, I'll address the first point around town and village partnerships. We're bringing a report in a few weeks to place around town and village partnerships as it's come out from economic development, and Ongar will be one of the areas we are looking at, and we are working with the parish and town councils. So the intention around town and village partnerships is to bring businesses and the parish and town councils together and the community to look at what we can do in those areas, not only for a bit from a business point of view, but also from a community point of view. So addressing in terms of rural areas and what we're doing in rural areas, I'll defer to Wendy in a moment because we have lots of community champions that are doing a lot, so that's one of the key ones. But also today, as I mentioned, we are looking at the rural hubs and we're trying to bring them into the key areas. Ongar is an area that we have identified. Obviously, due to access, transport, sometimes access to services can be limited. We want to bring the hub out there. It'll be a similar model to what we do in Waltham Abbey, where you have lots of different services in one location at one time, so people can access mental health, you know, citizens' advice, support for benefits, claims, our housing teams, and that's the intention with the multi-agency hubs. And finally, just in terms of the marketing is very difficult. We rely a lot on our networks, and a lot of within this network is actually volunteers, our own, not just our services, but the other statutory services, the community groups, and it's about working together to spread the word so we can cross-refer into each other, and there's a no wrong door policy. So should a member of the community, go to a service that isn't correct for them, then that service knows about someone else who can offer them a better intention. The other thing we also have is a very good tool, which I'd actually get everyone else to download if possible, and that's called Frontline for Epping Forest. It's a social prescribing tool, and it contains all the different services that we have in our district. It can be used both as a community member, and it can be used as a service provider as well. But you do have to Google Frontline Epping Forest, because if you just put Frontline in, you will get flea and tick treatments, unfortunately. So make sure, and that's run by our colleagues up at also CBSU, and it's been running for a number of years. And I'll put within the report about the growth of that programme as well. I'll hand over to Wendy to talk a little bit about community champions.
Thank you, Fabrizio. So the Community Champion Programme, I always go on about it because I'm so passionate about it. I've helped to develop it over the last few years, and I'm proud to say now that we do have 26 active community champions across the district, including rural areas, I'm pleased to say. So some of the rural areas that we are covered by is Willingale, Shearing, Nazing, Roydon. We've recently been able to get a community champion in North Weald. The only place that we really struggle with nowadays is Epping. I don't know why, but hopefully with the Town and Village Partnerships initiative, we can actually change that. Some of the activities that those community champions put on, I mean, we've got 4 of them that actually run the community hub at Chigwell, which is for the whole of the community there. But some of them put on fish and chip sessions, that's in Roydon monthly, a breakfast club on a Friday, every Friday morning in Willingale, and that's a really good breakfast, I've been there. But one good thing as well, and also in Shearing, our community champion there has been working with Essex Youth Service and Zinc Arts to get a youth club there. But what they've done more recently is they formed a constituted group, and that has enabled them to actually attract their own funding. And they did that with, they took advantage of the multiply funding from Essex County Council, and they ran lots of multiply sessions in their communities. And then they've been using the funding to take some of their communities on trips and things. They go on Canal Mobility. One of them managed to take their group to a really lovely hotel near Southend for an afternoon tea, and they was just so grateful. And they used Epping Forest community transport to actually get them there. So they, they really do try to work in partnership. There is a document as well of all of their activities they put on across the whole district, and we can supply that to members. But all of their activities are also on Frontline as well. Thank you.
Councillor Risby.
Thank you, Chairman, for allowing me to come in on this. And just to sort of explain in a tad bit more detail, because Wendy is absolutely phenomenal and is extremely passionate about the community champions. But if we explain from the start of this strategy, the concept of community champions was something which is non-existent, and it was a brainchild, and it's something which has really taken off, and we've had phenomenal intakes, and the calibre of some of these volunteers is absolutely amazing. These are people who are community champions in the truest sense. They have often grown up, raised families in their local areas, and feel a sense of duty to give back. So we are able to tap into their skills, their, local grassroots intelligence, and actually take that to the next level where it is now a formally constituted group. So that absolutely allows access to funding streams. The PFCC's fund, for example, that might be another step, another way forward to be able to build up on some of the projects that, the community champions in their respective areas have thought about. So You know, Wendy doesn't sing about it loudly enough. I think it's a phenomenal initiative. It's something that we are admired across from all of our neighbouring local authorities. When I go to the Essex County Council Health and Wellbeing Board, the other point about messaging, I think one of our main platforms is our own Epping Forest Health and Wellbeing Board. So we're delighted that we're joined by all of the local stakeholders, so Voluntary Action Epping Forest, Community Citizens Advice Bureau, the ICB, Essex County Council, Public Health. So lots and lots of different community and voluntary sector organisations who we use as our sort of disseminators to get info out to all of the respective areas.
Thank you. Councillor Murray.
Thank you, Chairman. I think the questions I was going to ask have already been asked and answered, so I'm not going to pursue those. I just want to touch on a few things that haven't been covered that have resonated with me. I mean, obviously the programmes we've heard tonight have been outstanding, and it's an important part of the work that EFDC does in partnership with other agencies. I just wanted to be very ward specific for my first comment. I have to say the work of the community engagement officer, and I think I'm allowed to use her name, aren't I? It's out there. Claire Evans is just phenomenal. She's been in post just over a year now, and the difference she has made to the Oakwood Hill area, and we're quite specific to use that phrase rather than the Oakwood Hill estate, but that's where it's concentrated. But it is the Oakwood Hill area has just been phenomenal, and what's on offer in that community centre for people to avail themselves of is just, you know, far more than I kind of envisaged would happen. And then the one-off events that have been organised, so I just did want to put it out there for Claire. The Safer Communities, and I know that's a slightly different issue, but the Safer Communities programme is almost coming to an end on the Oakwood Estate, and that's been a big improvement, and the whole area has been enhanced. A sense of community is beginning to develop. I mean, it will be slow, and I've really got to know the Oakwood Hill again after a 25-year gap, though I was chairman of the Old People's Club, but I didn't represent it until the new ward boundaries again. And the first thing I noticed was the lack of a sense of community compared to what there was a quarter of a century ago, when I suppose the old East Enders were still there. And they'd, you know, come together in the late 70s to live there. So well done for all those initiatives. I do want to just focus some comments around the Youth Council report, as that's been mentioned. I did manage to find time this weekend to read the whole report. I've already messaged Di Butler about my feelings around the report. Thought it was very good. Thought the Youth Council had done a really good job. They've obviously come up with some recommendations, and I'm not quite sure how we pursue those. I mean, they're outside our terms of reference as a district council, but I would like to think that at some stage, presumably the Youth Council would give it as part of their presentation to the main O&S committee at some stage. But I would like to think that those recommendations could perhaps go somewhere. It's difficult to know where, but I wouldn't want all that work to be done and something not happen with those recommendations. And I think the only final comment I will make, and I know a lot of this work is driven in partnership, and I know a lot of this work is through Pacific funding, but obviously some of the core funding of this work comes within our budget, within EFDC budget, and we've already been told, haven't we, by the finance portfolio holder at the last meeting, I forget which meeting it was, but the last meeting I attended, that this financial year is going to be extraordinarily difficult. So I would like to think that we could protect, you know, the core funding around these activities that come from EFDC. And also, I have to say, with the partners that we work with, that we fund, and I think everyone knows that that probably means the Citizens Advice Bureau. There may be others, but they don't come immediately to mind. Somehow we will do our absolute utmost to protect that funding. Thank you, Chairman.
Thank you, Councillor Murray. I don't think you was looking for any response, but I don't know, did you want to add anything for Fabrizio?
Just that.
Yeah, please do.
Yeah, just that ultimately, yes, we will look at the recommendations. I think we'll take them forward as a board, won't we, Councillor Ridgely, and then look at what we can do. And they've also been sent to colleagues at County Council, which ultimately have the statutory responsibility around smoking and vaping. So we will work with them closely to see what we can do.
Councillor Ridgely.
Thank you, Chairman. And you know, just on that point, because I'm really pleased, Councillor Murray, that you have brought it up, which is, you know, what do we do sort of once the Safer Streets funding, for example, is finished next year? I think ultimately the way that I see it, and it was something that I was really keen to try and establish when I took on the portfolio back in May of last year, which is how can we, you know, empower all of the various community areas that are being targeted to be self-sustainable, and how can we have an ongoing legacy? And at a time like now, when we're facing a great deal of uncertainty with LGR and devolution, what can we do to be able to build communities which are going to be fit for the future? And one of the things that people are all too often to forget, and it also something that will come up in the budget setting process, of course, is actually this isn't a statutory function of our local authority, and it's a testament to some of our officers who are absolutely phenomenal. You know, I cannot say the level of hard work, the effort that they put in. And that is very much why Epping Forest District Council is regarded as arguably one of the best run councils across all of Essex. It's not a coincidence. It's through a very robust scrutiny process like what we're undergoing at the moment, responsible leadership, talented officers, and it is something that sadly, as part of sort of cuts, it is seen as low-hanging fruit. The community portfolio is something which is always very, very vulnerable, which is why we need to have stable officers in post. We need to be exploring other lines of funding. We need to make sure that CVSs that we are giving funding to are making best use of taxpayers' money, and as part of that, we need to have a very high degree of scrutiny. We need to have a lot of transparency. We need to hold them to account as well. So, fully take on board all of the points that you mentioned, and over the next 9 months of this financial year, we'll be trying our best. But there's obviously it's very difficult to make any kind of set in stone assurances.
Councillor Brooks.
Thank you very much, Fabrizio. A most interesting report. A couple of comments and questions, really. It's about the data and about children's inactivity, which was a nearly 5% drop. Is this concentrated on, if it's children, is it classed as under 16, under 18, under 11? Up to 11 and under?
Yeah, so children is up to 16. So that's an amalgamation of all the data. They do separate it out on Sport England, but they do, in this case, I've put the data together and we've got...
Can you just tell us a bit about how it was gathered?
So Sport England do a regular survey, which is every couple of years, and they go out and survey schools. So they take a sample size of young children and they survey schools around physical activity. So they ask them how active they are ultimately. So it's a sample size that then's grown and calculated. I'm not a data expert, so I don't know the calculations, but ultimately they take a sample size from within each district and then take it from there.
Well, as you know, I'm particularly passionate children learn to swim. Just a comment, because it sort of verges also on some of the other things it touches on in the report about cost of living. One of our town councillors commented to me how expensive it was to take his children swimming to Loughton. I have made this comment to Places Leisure. Just a couple of children, because he lives some distance from the pool and they're quite young, he does park there for a couple of pounds. But, it's sort of costing him about £60 a month to take them swimming. And I know we've offered different deals. He said, is there any chance of a family swimming membership? And I discussed that with the contract manager, because we're offering individual swimming memberships, which have been extremely successful. This is one of the best things Places Leisure have brought into the contract. And it's really upped. But they say there's no chance of that. We offered it last summer, they offered it to children whose parents were receiving universal credit, I think, didn't we? Because we publicised a letter. But just, the thing is about swimming, that if your parents can't swim, it's not going to encourage you to swim unless you become quite confident. But, you know, it just concerns me. This must be average activity. It's not what children are doing in PE at school. This is, you know, they're looking at screens more, in other words. Yeah, thank you. And just the other thing is that I heard from someone who works for one of these private organisations that are now doing the pre-diabetic training. This is for adults. That this area had one of the lowest referral rates. I think she was only on about a third group in Loughton, whereas in Bishop Stortford she's on group 9 out of 2 years. And she feels that please, I know we've got a GP present, and I know it's an awful job, and no one wants to be a GP these days, I understand. But she said one of the problems is that the local practices don't study the pre-diabetic 42 to 47s in the same way that they're studied in Bishop Stortford. But I wondered if this is something that could be raised. And also she said that when she was looking for a venue to hold one, that they weren't particularly helpful about a room in the area to hold it. But this is just a comment that's been made to me, and they are, these are this week, this has been made to me. And I think it's not an accident. She knows I'm a councillor.
Fabrizio, would you like to come back?
Yep, certainly. So in terms of the swimming, Councillor Brooks, I'll take that back to James and Amelia. Obviously, it's swimming and contract management is those areas. In terms of pre-diabetic screening, this is something, again, we can take to the board, look at it as a board as an issue. I'd be interested to have a contact from that person, because we've got a hub here. We could run it out the hub. I'm sure we've got many venues within the community we could do screening. And we did 2 years ago do a project with Loughton Buckershill Chigwell, which was hugely successful, where we worked with New City College, we worked with the GPs in Loughton Buckershill Chigwell and did screening for anyone who was over 50 and hadn't had a health check in 5 years, and we captured 300 people in one evening. So the projects are there, we can do them, we just need the request. We've got a huge partnership that we can pull upon, and ultimately what we need is that contact. So if you know, have to take that contact and work with them to grow this, and we can do it by community champions as well, we can really grow the project.
Thank you. I believe that's all of the questions and comments. So I just would like to personally thank Fabrizio and Wendy this evening for bringing this comprehensive report and presentation to us, and highly commend the hard work and efforts that have obviously been put in to support and improve the strategy. The successes are great to hear about, and I know we are very proud at Epping Forest District Council of everything that's being done. And obviously we always strive to do more, so but we're very, very proud, and I'm pleased to hear of all the successes. And also I just think it's so important to keep monitoring these trends, and as Fabrizio said, looking at the data and getting more up-to-date data and accurate data, because that is so important in directing the priorities of the strategy as well. So I'm pleased to see it is obviously being closely looked at and hopefully going to even be improved. So it's just really a thank you from me to end that report. I believe now we just go on to the dates of the next meeting. So that obviously, following what was discussed earlier, will have to be brought forward potentially, but obviously we'll still have the communities meeting on the 16th of September, probably with an additional meeting that will be brought forward as was just explained by Laura from Democratic Services earlier. But thank you very much all for attending, and a particular thanks as well to Councillor Rizvi, portfolio holder, for your input this evening, which I thought was quite valuable as well. Thank you, everybody. I end the meeting at 8 minutes past 8.